everyone. So today we are going to do the bloodborne pathogen training. I apologize if I mispronounce word or anything like that, so bear with me. What are bloodborne pathogens? They are microorganisms carried in a blood that can cause disease or illness in humans. Microorganisms are they are seen through a microscopic, like bacteria, and the word pathogen refers to virus, bacteria that can cause disease. They can spread through contact with infected blood. They are found in body fluid containing visible blood, semen, and vaginal secretion, torn or loose skin. Bloodborne pathogens in stool setting can enter via open cuts and nicks, referring to small cut. Skin abrasion. Abrasion is something that tears away or wears away. Dermatitis is a skin condition that usually becomes red, swollen. Acne, characterized by red pimples. Mucous membrane of your mouth, eyes, or nose via a splash or blood or body fluid. Mucous membranes are referred to the inner lining of some organs and body cavities such as nose, mouth, lungs, and stomach. And then also accidental injury with a sharp object contaminated with infectious material, needles, broken glass, etc. Common bloodborne pathogen disease. Malaria, caused by a parasite spread in humans, bites of infected mosquitoes. Parasite is referring to an organism or living thing that can cause disease in human. Brucellosis is bacteria disease that can cause a rising and falling of fever in humans. Syphilis is a chronic bacteria disease contracted by infection during sexual intercourse. Hepatitis B is a disease spread by exposure to infected body fluids. Hepatitis C virus spread with contaminated blood. Human immunodeficiency virus, HIV virus attacking the body immune system. HIV is a virus that leads to AIDS. HIV depletes the immune system, uses up. HIV does not survive well outside the body. No threat on contracting HIV through casual contact. Is spread primarily via unprotected sex, shared needles. Symptoms, flu-like symptoms, 2 to 4 weeks after exposure. White spots or unusual blemish on the tongue, mouth, or throat. Fever, enlarged lymph nodes, sore throat, and rash. Lymph nodes are small bean-shaped structure that is part of the body immune system. Statistics on HIV. About 50,000 people get infected with HIV each year. In 2010, there were around 47,500 new HIV infections in the United States, according to CDC. More than 1.2 million people in the US are living with HIV infection, and almost 1 in 7, 14%, are unaware of their infection, according to CDC. Hepatitis B, inflammation of the liver. Contagious liver disease that results from infection with the hepatitis B virus. No cure, vaccine available. Inflammation is referring to the part of the body that's red and swollen. Symptoms: jaundice, fatigue, abdominal pain, loss of appetite, nausea, vomiting, dark urine, joint pain. I believe that's instead of pain, it's referring to pain. Hepatitis B virus is transmitted primarily through sexual contact, transmitted through direct contact with infected blood, semen, or vaginal fluid. 100 more times more contagious than HIV, able to survive on surface dried and at room temperature for at least a week. Contaminated surface are a major factor in the spread of hepatitis B virus. Hepatitis C is the most common chronic bloodborne infection in the United States, may lead to chronic liver disease and death. It's spread most commonly through shared needles. Symptoms include fever, jaundice, fatigue, abdominal pain, loss of appetite, nausea, and vomiting. Potential infectious bodily fluids: blood, saliva, vomit, urine, semen or vaginal secretion, skin tissue. Cell culture is referring to it determines what kind of infection or bacterial infection. Any other bodily fluids, chewing tobacco. Airborne route of transmission of communicable disease. Airborne or droplet spread occurs by coughing or sneezing. Most diseases in the category are more effectively spread via direct contact. Prevention: always cover your mouth and nose when coughing and sneezing into arm instead of hand. Use tissue and discard after use. Wash hands often. Example of possible airborne illness: the common cold, influenza, which is infection of respiratory passage causing fever, severe aching. Tuberculosis is bacteria disease affecting the lung. Chickenpox, virus causes painful skin rash. Strep throat, sore throat with fever. And COVID-19, which we've been going over the last 2 years. Contact spread, direct or indirect. Direct contact spread occurs with skin to skin contact or skin to mucous membrane contact. Saliva, mucus, eye discharge. Pus or weeping. Pus is referring to a thick yellowish or greenish liquid produced by infected tissue. Examples: pink eye, lice, chickenpox, and scabies. Under example, conjunctivitis is referring to the pink eye, and impetigo is contagious bacterial skin infection. They're kind of similar. So indirect contact occurs when the organism is able to live on the object that is then handled by another person. Mucus on a tissue, saliva on any object. Prevention of contact. Cover any sore or lesion. Avoid touching someone else's sores. Use gloves. Do not share clothing. Discard any soiled articles, Kleenex, and wash shared items soiled with saliva between use. Always wash hands after handling soiled articles. Fecal oral route transmission occurs by not washing hands after toileting. The virus or bacteria is found in stool. Follow the hand washing procedure. This is essential for the prevention of spread. Exposure could occur well before any symptoms may appear. Example: diarrhea illness, salmonella, shingles. I apologize for pronouncing hepatitis A, worms, hand, foot, hand, mouth disease. Salmonella is referring to food-related illness. Shingles is referring to a viral infection caused by a painful rash. Hepatitis A, contaminated of food or water. Pinworms is a living organism that can live in large intestine of humans. The hand, foot, and mouth disease virus causing sores in the mouth and a rash on the hands and feet. Your exposure potential in a childcare setting: administering first aid, bleeding injuries, biting, loose tooth, changing band-aids or dressings, handling breast milk, CPR, post-accidental cleanup, handling of any waste product. Universal precaution: use of proper personal protective equipment, treat all blood and bodily fluids as if they are contaminated, proper cleanup and decontamination, disposal of all contaminated materials in the proper manner, wear gloves when you anticipate touching blood, body fluids, or contaminated surface, cover hands cuts with band-aids before gloving, wash hands after removing gloves. Personal protective equipment, PPE. Anything that is used to protect the personal from exposure, latex or nitrile gloves, goggles, CPR mouth barrier, aprons, respiratory, face masks, etc. PPE is provided by employer for staff. PPE rules to remember: always check PPE for defects or tears before using. PPE becomes torn, defective, or soiled, remove it, get new one. Remove PPE before leaving a contaminated area. Do not reuse disposal. Clean up body fluids. Obtain bloodborne pathogen body fluid kit at site. Put on gloves. Observe the fluid with paper towels or other absorbent materials. Place the towels into a plastic bag. Saturate the surface with a cleaning solution. Apply disinfectant. Herbicide to kill any virus. If possible, wait 10 minutes or let the surface air dry. Dry the surface if you need to use it. Place your absorbent in the plastic bag. Remove your disposal gloves and place it in a bag. Place the contaminated materials in a sealed plastic bag in the regular trash. Hand washing. Hand washing must occur for children and adults immediately before and after preparing, eating, or serving food, and after meals or toothbrushing, before and after participating in cooking activities, after diapering, toileting, or assisting children with toileting and nose wiping, after handling pets in cages, after coughing or sneezing. Adults wash before and after giving medication, including fluoride, after contact with potential infectious materials, including after removing gloves, when hands are visibly dirty, to help decrease illness and the spread of germs. Hands should be washed. Upon arrival at the center, before and after using sensory table, after playing on the playground, before leaving the center. Hand sanitizer may be used if no sink is available, but hands should be washed with soap and water as soon as possible. Hand washing procedure. Use warm running water and mild liquid soap. Wet hands and apply a small amount, dime or quarter size soap. Rub hand vigorously until a soapy lather appears, about 15 seconds. Make sure to scrub between fingers, under fingernails, tops, and palm of hands. Rinse hands under warm running water. Dry hands with a clean disposable towel. Turn off the faucet using the towel as a barrier between your clean hands and the dry faucet. Discard the towel in a plastic-lined trash can. What is an exposure incident? Affected employee, referring to full-time staff, part-time staff, student 8, federal works study, practicum, clinical students. Potential affected substance, blood, bloody, vomit, urine, feces, saliva, visible red, pink, semen, vaginal fluids, bloody and non-bloody, saliva from bite, which breaks the body skin, clear fluids from joints, the spinal column, brain, or heart. Enter employee through non-intact skin, cuts, paper cuts, abrasion, dermatitis, dry cracked skin, hangnails, eye, mouth, nose, genital, mucous membrane, needle stick, sharp, piercing object, bite which breaks the skin. Reporting an exposure incident. Wash your hands for contaminated skin. Disinfect the affected area. Get assistance if needed. Tell your supervisor they must report the incident immediately to Human Resources and Environmental Health and Safety. Complete an MHCC incident, injury, and incident report for first aid assistance involving blood. Post-exposure steps. Baseline blood test for HIV, hepatitis B, hepatitis C within 2 hours of the incident is recommended. Contact environmental health and safety if contracted healthcare facility is needed. MHCC Environmental Health and Safety will conduct incident investigation. Additional forms may need to be completed for tracking and follow-up. Workers' compensation, paperwork, lab tests, and medical costs are paid by the employer. Healthcare evaluation, follow-up test schedule, and counseling refer to the MHCC Bloodborne pathogen post-exposure procedure. In conclusion, bloodborne pathogen rules are in place for your health and safety. Failure to follow them is a risk that does not need to be taken. Wash your hands often. The resources. Auckland Community